A hot topic in Medicare is GLP-1. So many beneficiaries that come to our office are asking us about GLP-1s. It's a hot topic in any space in the health industry in general, not just Medicare. GLP-1s have taken the world by storm, the United States by storm, because we've now found another use for them. Originally, GLP-1s, and still their primary function use is for diabetes. And so many beneficiaries who get put on a GLP-1 are using it for diabetes. Now, if you've kept up with any news at all or know anything about GLP-1s, you know that they've actually been more commonly used recently for weight loss. That's where many patients are starting to use these GLP-1s for, is weight loss. And one of the negative effects for that is GLP-1s, the prices have skyrocketed. They have gone way up because so many people are starting to use them. And we've actually have beneficiaries who, they get a little frustrated. They're like, this GLP-1 wouldn't cost me so much if everybody were just using it for diabetes. And while that could be true, it's not always that simple. They have been very popular. That's the point that I want to make. And there's a lot of questions around GLP-1s in Medicare. Will Medicare cover GLP-1s? Well, the short answer is yes, but we're going to talk about for the next few moments how that's going to work, what that's going to look like. But before I jump into this video, I do want to say nothing beats talking to an agent one-on-one. And we want you to reach out to us, talk to one of our agents who are ready to discuss GLP-1s with you. We have the tools necessary to find out exactly what it would cost you on your Medicare plan or the Medicare plan that you are going to enroll into. And the way you can talk to one of our agents is follow the information in the description of the video below, and you will be able to reach one of our agents who is ready to help you today. Now, let's get into GLP-1s. What are GLP-1s? Well, they're medications that were designed for insulin resistance, and over time, we found out that it can help with suppressing appetite, which ends up leading to weight loss. Two of the popular ones are Wegovy and Zepbound. There are other ones like Ozempic, but you're gonna see that Medicare is primarily going to be affecting Wegovy and Zepbound because we do have a major change with Medicare that's taking effect July 1st of 2026. This is the GLP-1 Medicare Bridge Program. And what this is going to do is it's going to help rein in the cost on these GLP-1s for anyone that's using them, and that's what we're going to talk about. So the point that I want to, before I jump into the GLP-1 Bridge Program, the point that I want to bring up is the Inflation Reduction Act. That's the IRA. That's an act that was passed by the government in 2023. That's when it took effect. It was January 1st of 2023. And what this did in 2023 is it affected Medicare beneficiaries, their drug plans, by putting a cap on covered insulins for diabetic beneficiaries. And again, this is a cap on covered insulins, and this cap was $35 a month. So $35 a month, what that means is that insulins were now going to cost at most $35 as long as it is covered by the plan, so on insulins. And those are things like Humalog, Novolog, you know all the insulins out there. As long as your plan covered it, it now had a $35 cap. If your plan doesn't cover it, well then that would still be your responsibility full cost. But this was a positive change. This helped a lot of beneficiaries who are diabetic taking insulins because you know just as well as I do that insulins can be very, very expensive. Well, we fast forward in 2025, the IRA added another change, and this was January 1st of 2025. This was now a $2,000 cap on all drug plans for all medicines. What this means is now every Medicare drug plan had a $2,000 max out of pocket on all covered medicines. This is not just on insulins anymore. And this really changed the Medicare prescription drug world. And we saw a lot of positive and negative effects. Positive, obviously, is that now medicines weren't going to cost an arm and a leg for someone who got put on some kind of expensive medication that they had to take the rest of the year because you have a $2,000 cap. That means you have a $2,000 worst case scenario cap on your medications. Some of the negative effects were that some of these drug plans started dropping expensive medications, including GLP-1s. They didn't want to cover GLP-1s anymore because people were using it for weight loss and diabetes, and they were getting very expensive. So a lot of the carriers said, we're not going to cover that anymore. We have to cover everything above $2,000. We're not going to cover that. And then in 2026, we saw one more change, and that is that max out of pocket went up to $2,100. So at the beginning of 2026, we saw this go up to $2,100. Again, that's still a good change. $2,100 max out of pocket is very good, very, very good price for beneficiaries at the same rate we're seeing some of these medications fall out of the formulary. Now, when it comes to diabetes, we have the same thing going on, $35 cap on insulins. And when it comes to GLP-1 specifically, they are covered for diabetes, but the problem is we couldn't really prove that without a doctor sending some kind of prior authorization, some kind of referral or note saying this person needs this GLP-1 for diabetes. And what was happening is many beneficiaries were needing things like Wegovy, they were needing Zepbound, but they were having to get prior authorization saying, I have diabetes, I need this medicine. And a lot of times the carriers were requiring steps therapy. And what steps therapy is this process of the carrier saying, you need to try this treatment first before we approve this treatment. So a lot of beneficiaries were needing Zepbound or Wegovy, maybe Ozempic, but they were having to go through other treatments to prove that they weren't working. And this was very frustrating for a lot of diabetic customers. Well, this GLP-1 Bridge Program is going to make this very smooth going forward, because what's happening now is weight loss is actually going to be approved. We have 3 drugs that are approved on the GLP-1 program, the Bridge Program. And the 2 popular ones are going to be Wegovy and Zepbound. And what this is going to do is now Medicare will cover GLP-1 medications, Wegovy and Zepbound specifically, for $50 a month, which means that they will cover everything but $50, and the beneficiary will have to pay $50 out of pocket. And that is for weight loss. Certainly will work for diabetes too, because now if I'm taking that medication, I'm going to qualify for this GLP-1 to be $50 a month. There are a few requirements. Obviously, if you're diabetic, that will mark one of the requirements. But if you're taking this for weight loss, you have to have a BMI of 35 or higher, or a BMI of 30 and higher with weight complications, things like sleep apnea, right? So now you can actually get the GLP-1 on Medicare, and you only pay $50 a month. Now, this will not work for popular drugs like Ozempic. It is only for Wegovy and Zepbound. But this is very good news, because a lot of beneficiaries have been trying to find a solution for their weight loss journey. They need this for diabetes, and we now have something that is going to help with this, and there's a specific medicine on file, which means that these carriers are going to have to cover those medicines and give you that $50 monthly copay, which is very beneficial. It's great. Listen, there's a whole lot of information that you need to know about drugs. It's not just GLP-1. This is a major change that's helping Medicare beneficiaries. We're very happy to hear this. It's going to help a lot of our customers, but there are other things that you need to consider. And we have agents that have the right tools to put your medications, your pharmacy, your doctors in place to find out what plan you need to be on. And that's if you've been on Medicare for a long time, or more importantly, you're going to Medicare for the first time and you don't want to make a mistake. You don't want to get on the plan that doesn't cover your drugs. There's lots of nuances you need to understand that our agents do know. So follow the information in the description of the video below to talk to one of our agents today. Listen, Medicare is a journey. We're a compass. Use it.